So welcome to week 3. It's going to go by very quick. So again, I'll tell you, do not get behind because about week 7 and 8 is going to get pretty scary trying to keep up with everything. Some of you who hadn't finished all of the requirements for week 2, I sent messages and I got great response and everybody got their work in. So congratulations. I don't think I've ever had a whole class do exactly what they were supposed to do. I posted it in the announcements. I got some messages about it. It's okay. If you don't understand, you're confused, get 3 classes. And I'm sure some of them send you lots of announcements. So I don't mind clarifying, and usually I'll just copy and paste that announcement, let you know what's going on and highlight, the important areas. So thank you very much for listening and following through. I hate students not to get the attendance when you're putting in the work, okay? And I would hate anybody to get a 20% deduction in their grade due to lack of attendance. So I don't want that for anybody. And I want to make sure the attendance is correct. So week 3, we're going to go over school age and we're going to go over adolescence. Again, I'm going to do a PowerPoint and then I have a Kahoots for you all. When we are done, somewhere around 5, hopefully a little bit before, you'll be doing your quiz 2, and those who had didn't get to a class last week can also do the quiz 1. The quizzes, they're similar in content. We find that understanding the toddlers, the preschoolers, and infants is a lot of the growth and development that you really need to understand. So we have quizzes, 2 of them, they're very, very similar. Next week is your first exam. I have posted those review times. We're doing them Wednesday, Thursday, Friday, Saturday, all different times of the evening, afternoon, and morning. So you can choose one. If you cannot attend any of them, I will be posting the recording. Now, what I do is I take the recording, which says reviews, I keep editing it and putting the new review there. So you're not going to have 4 different announcements. So that'll keep you organized. I'm also going to put all your Kahoots in one place. So if you want to go back and review the Kahoots, it'll be in one place to go look for it. I also am finishing the study guide, which should be out by tomorrow evening, so that you'll have that to be able to go over when we're doing those reviews. You can see, what we're talking about, and of course, the study. Remember, the PowerPoints are also a great tool. There's a lot of good information in them, and to review those too, and you should be successful on your exam. When you come into the exam, make sure that you have everything charged or plugged in. I've had students where their cell phones die or their computers die. So just make sure, just giving you, heads up, warning, it does happen. So let's try to prevent that from happening. When you come in, you make sure you have your ID, whether it's school ID or your license is fine. I'll be checking that in your desks and making sure that you're set and ready to go for the exam. There is a class following the Zoom, and we should be getting back in enough time for me to do, I'm going to either do a PowerPoint or I'm going to do the Kahoots. Now, if I do one or the other in your class, in the other class I'll do the opposite, and I'll post also that recording for you so that you can say, well, I did the PowerPoint with you, but my class on Wednesday, I did the Kahoots instead of a PowerPoint. You also can have both of them. So you'll have both of that information. And I've seen in the past that that works really good for y'all. So I'll do that for you. Any questions? Now, I know some of you have mentioned that you have another exam on Monday, next Monday. Now, if you're one of those people, send me a message and tell me what campus. I'm trying to ask the dean, but I just sent her another email as we were sitting here, saying that if I check with the deans to make sure that, yes, you do have another exam on that day, that I can put it off till Tuesday. And if you do Tuesday, what you will do is you will show up for Professor Morris's class at 3 o'clock. That would be the compromise there. Okay, if y'all can do that. If not, it would have to be on Wednesday with me at 3 o'clock. So let me know your availability and what if you do have another exam, and I need to validate that. Okay. So next week, what we have due is the burn study. We have quiz 2, which we're doing, and there are some NCLEX questions. Now, the first set of NCLEX question is all about growth and development. Make sure you can look at what topics are due. Okay, just don't pick pediatrics. The first one is all growth and development. So make sure you do the 50 questions, new questions, of course, on the growth and development. Okay. And I do check that. If I find that, let's say you forgot, you had a moment, I have them all the time, that I'll send you a message. I'll put a 0 there, but you have a chance to resubmit. I will, if you submit something, I'm not going to hold you late. I'm not going to give a deduction, but try to do what you're supposed to do the first time, and you don't have to redo them to get that credit. Because each NCLEX question set is 1.25% of your grade, and it can make a big difference if you're right there on the borderline, and I don't want anything to happen to you. So let's go ahead. Let's get to our PowerPoint. And again, anybody doesn't understand something, I want you to stop me so I can help you and for you to understand. I'm sure somebody else will have a question too. I don't mind being stopped at all. So we're going to go over chapters 34, 35. This is school age, and then it's the adolescent. So school age children. These are children ages 6 to 12. So if you can see, it's a really broad age span. Starts out, they're almost kids, almost, toddlers. They're still learning. They still have their baby teeth in. We know at age 6 is when they start to lose all their teeth. And then by age 12, their permanent teeth should be in. So it starts with baby teeth coming out, and it ends with their final acquisition of all their permanent teeth. At this point, they're going to grow slow. You'll see them stair step. My little grandson, he's 6, just turned 6. And all of a sudden I look at him and he's skinny again. Well, he's going to plateau, get pudgy again, and all of a sudden he'll squirt up again. And that's just absolutely normal. This is what you want to see, a gradual growth and development. And the one thing I'll warn you about with school age children, some of them look a lot older than what they are. Make sure when you're addressing a child, you know their age, that you don't talk over their heads. Remember, we always get on their developmental level. So make sure we know what age we're talking to, because some 10-year-olds look quite old. So just to be aware with that. You start getting about 2 inches a year growth, and weight is 2 to 3 kilograms per year. Between 6 to 12, it's a long time, their weight will double. But at the end of it, boys and girls are still the same size. You don't see the boys bigger until you get to that pre-adolescent growth spurt and into adolescence. And then you'll see the guys getting bigger. They become more graceful. Their legs become longer. Their fat starts to disappear. And they're getting more muscle now. So you could see that they're getting more athletic. They're more graceful than they were when they were younger. We know the head has nothing to do with, the chest or anything anymore. And we know that they go from baby faces to now more grown up faces. And as I said, loose teeth, age 6, that's when they start coming out. Can't wait for my first one that my grandson has. I hope he's with me here at my house so I can put that little dollar bill underneath the pillow, right? I'm going to be the tooth fairy again. I thought I was over that. Not yet. As their systems get bigger, their bodies mature, their bladder gets bigger. They can hold it longer, so car trips aren't going to be as bad, right? Their heart is smaller in relationship to their chest now. It doesn't take up the whole chest like it used to. Their immune system, they've gotten immunizations like crazy from infant all the way up, and they've already had how many colds, earaches, upper respiratories, all of these things. So their immune system's getting really, really strong. Whereas the bones used to be a little bit malleable, like the skulls could reshape. Well, now they're starting to ossify, which means now they're going to crack, and it's not going to be able to be that molding like we did have before. And again, as I said, physical maturity is not correlated with their emotional and social maturity. We know that these children are still school age. Many of them are very naive, and some aren't, but many, many of them are. Now, a child that starts to have some behavioral changes, physical symptoms, this is when you know something's going on in their life. It could be a divorce with the parents, or it could be something with a brother or the sister, maybe someone in their family died. So behavioral changes and maybe getting heavier, skinnier, all of these things can show distress. And it's something, if we become, those school nurses and we're seeing it, that we should be aware that this could be one of the symptoms. So prepubescent, I've talked about it. That's right before puberty. That's like ages 10. We know that pre-adolescence is 2 years before the age of 13. So that's at 10, 11. We know that puberty starts with girls about age 10. That means not necessarily the menses. That's just maybe they're getting those little breast buds, which is where they start at, and boys is 12. Remember back in 5th grade and, girls were, wanting to have a boyfriend, and boys were just silly and dumb still because their maturity, they haven't grown up. They're 2 years behind girls at this point. They catch up later. Now, assessing a child, again, get on their developmental level and explain things according to that level. For instance, you have a 6, 7-year-old, even 8-year-olds, and you say, "Oh, you're going to go get an X-ray." Well, they might think they're having radiation beaming through them. Who knows where their imagination takes them. Just say it's a big camera. It's going to take a picture, and we can see the inside of your body. I always would show them their X-ray. I would show them pneumonias. I would show them their broken arms or broken legs or finger or toe. And they'd go, "Wow, look at that." So now they're learning, they know what's going on, and now they're not afraid of an X-ray. And I've, stopped those fears because kids don't like those people who always give them injections and hurt them every time they see them. And that's what we do, especially if it's just well checkups, immunizations, right? So we first inspect, which means look. With children, you can see things and you don't even have to listen to them. You can see what's going on. You can see them with respiratory distress. You can see them, they have abdominal pain, they're bent over, they're, holding their right lower quadrant. We know it's an appendix just by the way they're limping in. So look first, then auscultate, then percuss the area and palpate it. And that should be the way we assess. One of the Cahoots questions last week was lymph nodes. You shouldn't be able to feel them unless they're sick. They should be not there. So if they're sick, you're going to see those lymph nodes swelling up. Now, doing an assessment on a child, even infants, doing that hypoglossal nerve. How do we check it? Well, stick your tongue out. You can get an infant to stick their tongue out too, because they like to imitate. So it's actually pretty easy to do that. And there's different sort of breath sounds. Children, we can have all this upper airway, bronchial mucus sitting there, and it sounds like terrible rales and rhonchi in their lungs. But if we put that stethoscope just right over the trachea, not on the lungs, and we hear that gurgle, gurgle, we can probably say cough, blow your nose, and it probably will get clear in many cases to know that the lungs are clear. That was all bronchial sounds. Okay, going into Freud and all the theorists. So school-age children. So Freud is all about same-sex peers. And we call it the latency period of psychosexual development. This is, you have friends, they're not, usually girls go to girls and boys go to girls. Also, latency is mom is closer to the boys, and then the girls are closer to their dads. And that's psychosexual, that's the latency thing we talk about. Now, Erickson talks about industry versus inferiority. Industry, what I do well. So if you give a school-age child a task to do, make sure it's something that they can accomplish. Not that it's easy, but they can accomplish it. So they have a sense of reward when they're done. You know, they want to feel, oh, I did it, I got it done. Because if not, they can't do it, they're going to feel inferior and they're going to feel bad about themselves. You have some children who play an instrument. You have some who can sing, some who play sports. Some are good at math, some are good at spelling. That's their industry. That task they do well. Now, the inferiority is those things that these children cannot do well. You know, you have children who are good at sports and bad at schooling, or they're good at schooling, bad at sport. It's either or. You know, and because they can't do everything well, that's their sense of inferiority. You know, as I said, you know, focus on what they do well, their industry, and not on what they can't do well. Now, Piaget is starting to understand more about why things are done. They do need to see it and understand it to be able to do. They also are pleasers. They want to please their adults. So they want to do good in school and they want to behave well. They're masters of conservation. And that's basically a couple different things. It could be you have a ball of clay and it's a ball and it's big. You smush it, it's still the same. Or you put water in a big cup, tall and skinny, and it was in a short, fat one, and it looks bigger, but it's the same amount of fluid in each. Another way I describe conservation is, you know, my children, I would buy them both a box of Little Debbie cakes on Friday night when I went grocery shopping. So when they got home from school during the week, they could have a Little Debbie cake. Well, they knew if they ate all of them before next Friday, there was no replacements. So they learned, well, my son used to hide them all over the place from my daughter, but they would save them so that they would make sure they have it. And that's what conservation means. They're planning ahead and they're conserving what they have to make sure it lasts. They also do these classification skills, like a child who collects all airplanes or all cars or all tractors. They're groups, or it could be coins or shells, and they just collect them, but they're in groups that they all are the same type of things. This is what I was talking about, the clay and the glass and all of these things. They're all the same, but they're all moved around a little bit, and they're starting to really get that. So, Socio Centricity. So this is when they're starting to understand, you know, mommy's on the couch, she's got a blanket on, you know, and she's there drinking her ginger ale and not feeling good. And mom, you know, the child knows something's going on. Well, let me go get your favorite little Afghan or your blankie from your bed and let me give it to you so that'll help you feel better. Or here's my teddy bear, I'll let you feel better. Is starting to understand other people's feelings, that they can see it and they react to it. They're very into wanting, again, to please, and they want you to feel better too. So formal operations is, you know, that 11 to 12. That's the last of all of Piaget. And this way, in this age, they can take a problem and figure it out through logic and in a methodical way, whatever it is. You know, if they want to get something done and mom don't want you to do it, well, what can I do to make her say, oh, okay, I'll let you do it? And they're very conniving, as I call it, trying to get what their needs are. And they'll figure out many different ways to get there. Kohlberg, again, good and bad and a consequence for either, okay? So the 6 to 7 year old is still reward and punishment. If you take and you do your homework. When you're done, I'll let you play on your computer for 30 minutes. So reward and punishment. Okay, you played on your computer 30 minutes. You're not giving it back to me. Tomorrow, you don't get a computer no matter what. Okay, that's reward and punishment. The older children are starting to be able to understand, I did something wrong, so all right, I know I'm going to be punished. They know it before they even get it. And as I said, the older ones tend to do what they have to do because they want to please, okay? Spiritual development. Well, children, again, especially younger ones, very concrete terms. You know, if we talk about our religion, whatever it is, you know, it's seeing, as in my house, the manger with Jesus in it around Christmas time. Or the younger kids, it's the Christmas tree. Maybe they don't know church or know religion. You know, it's what they see, they know. So that's that concrete terms. They want to know what that super ego or their conscience or God, whatever the name you call the God, they're starting to want to know that. The other thing that I see with these children is that they think they are being punished by God when something goes wrong. I've had many children come in for appendectomies, and before they go upstairs, I'll always sit next to them and I'll say, listen, you know, there's a little piece of tissue in there that just doesn't want to be there anymore. So we'll go through your belly button, we'll take it out. And I'll make sure that they put extra stitches so your inside don't come out. But I want you to know it's nothing you did wrong. It's not because you hit your sister yesterday. It's not because you didn't do good on your exam or your test or whatever. And you know something? Emotionally, they feel much better. You actually watch their shoulders drop and you think this is why it works. And it does help with a better outcome and a better recovery because they're going into it. They're not worried now. And they're going to, you know, hop on the OR table because they know everything's going to be okay. All right. As I said, peers, so important. Same-sex peers. Many children will change their after school, whatever, just to be with their peers, their friends. Maybe I wanted to be in basketball, but my friend wants soccer. Well, I might switch to soccer, or they may switch to basketball. You know, they're pleasers. They want their peers for that belonging there. Clubs and peer groups. We know there's Girl Scouts and Boy Scouts, and there's Little League and, you know, soccer leagues and whatever. Remember, these are good, but remember, there's always that one person. Why did you not hit that ball? Why did you forget to bring this ingredient that we're baking a cake? Why did you? And they're bullies. And you'll see that everywhere, whether it's school, groups, whatever. So important that these parents are involved, that they are there to praise them and to be there for any of this conversation about bullying so that they can let them know that it's, you know, it was my fault. I forgot to buy the flour or whatever it was, or I forgot to whatever. And that actually makes that child feel a lot better. We know in the younger ages, children are mostly at home. They don't go outside the home as much. They're not over at their friend's house as much. I mean, family, cousins, yeah, that's one thing, but somebody else different from that family group. But now they're starting to have little sleepovers or going over for Saturday afternoon or going to movies or dinner with the other family. And they're starting to get independence. And it's good because eventually these children are going to move out of the house. And they need, because of college or just getting older, need to move out. They need to learn independence. And parents need to be adults at this stage. They don't need to be their friends. They need to be consistent, need to have the rules. They need to be adults. Play will always be important. There's rules and there's rituals. Well, what is life? What is going to work? There's rules and rituals you have to do. So play is starting that teaching for them. working as a team, working alone, and making yourself feel good, doing something, doing it well. So children start develop this self-concept, like, who am I? What can I do well? What do I believe in? And what do I look like? Do I have cute blue eyes? Do I have beautiful blonde flowing hair? Do I have what? Freckles everybody talks about. They're starting to know who they are and their appearance, and it's important for them to look good. When they dress, they want to look cool. Even my little 6-year-old grandson wants to look cool, even at the beginning of school age. It's just part of it, what they want to portray for other people. We know that there's more than just parents teaching your children. You have, whether it's at church or Sunday school, or whether it's at sports, or just out school or aftercare, or the sports after school. These are other adults that have an influence on your children. Again, they can help them to feel good about themselves and to succeed. And that's what they are there for. And what all of this stuff and doing well, it leads to that positive self-concept, and they feel really good about themselves, and they're happy kids. Body image, as I said, when they're younger kids, they don't understand their blonde hair, blue eyes, their brown skin. As my grandson said the other day, I'm like, okay, whatever you think it is, that's what you know. They're starting to know that there's differences. They're not starting to know that there's different cultures, different bodies. There's skinny, there's fat, there's, hearing aids, and there's glasses. And as they get older into school age, the braces or whatever, they're starting to know what their body image is, and other kids. When children start going to school, it is now they've stopped going to daycare. Well, now it's going to be work at school. And usually they're at home and then they're at school. So that is the second place that they're socializing, and with other kids. Remember, they're learning values and cultures from other children. So they're learning more there. Again, peer relationships are becoming important. I like to have their buddy that they can talk to and go to lunch with, or be an after school care or whatever. Nutrition, 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 right? I'll say it every probably class that we have. Most important thing for these children still to grow and have good cognition and feed the brain and the muscles. We know today that you need, if you're lucky to have 2 parents in the house, both need to work in order to support the house. Many times, parents will go through a drive-through or call for a delivery because they don't have time to cook. So there's a lot of fast food coming in. The one concern about that is obesity in children, and getting them the proper nutrition. What we try to do with school-age children is have them learn what is a proper diet. This My Plate is a computer program where they can look at what they ate for the day to see if they ate the proper food groups. So get them involved in it, right? So health concerns and obesity today, because of two parents working and fast food, that's one thing. But because children are more inside playing on video games, computers, telephones, they are not exercising like they used to. Back, when I was a kid, a long time ago, you'd come home, change your clothes, and you'd get on your bike and you'd ride to your friend's house. And you'd be outside, running around, doing whatever. It's not like that anymore. Kids are more to themselves. Plus, do they have a neighborhood that they can do it? That's one of the things. The neighborhoods are becoming more unsafe in many places. It's at an epidemic proportion right now. How many kids are overweight? I have 2 grandsons that are older, and they're both pudgy, but they've got them in football. I mean, the younger one, say a big boy, he's a tackle. And actually, he's one of the all-stars. So they're trying to work with him. But, overweight is a big thing. When you have an overweight child, you have an increased risk of hypertension, diabetes, and high cholesterol because the cardiometabolic changes in their body. So early education has shown to prevent it. School-age children are one of the best ages to teach children. In Florida, I remember my kids went through Dare to Keep Off Drugs. Well, now they're doing all about food and, food choices, and even the school lunches, they're trying to be better. They're better than they were, but they've got a way to go yet, but it is trying. So keeping a child from being obese should start when you're pregnant, in the prenatal period. Eating well as a pregnant woman. Well, we know we should. We know we always can. Could be financial, or we have to run because you're busy. We know that. We know it hits every ethnic group. It doesn't target anybody. And we know if we take school-age children and teach, we know it's going to help prevent obesity. I think one of the things that when the kid's smaller, you need to finish your plate before you get up, before you can get off the dinner table. And what that does, it starts making a child feel that they have to always finish their plate. And if you have to always finish their plate, that these children are going to get heavier because they can't, leave food on their plate. And they become adults that won't leave food on their plate. So one thing we don't do to school-age children is they need to eat a certain amount, but you don't need to say, all right, clean it. School-age children do not need as much sleep, but still need quite a bit, 9 to 11 hours a night. We know that there is going to be fighting going to bed. We know all about that. And we know that children that are like 12, those children are really less resistant to going to bed. The younger kids are going to have their games. Yeah, I have to go to the bathroom. I need something to drink. I need to kiss mom. You need to kiss daddy. Read me another book. I mean, it could go on and on and on all night long if you let them. We've already basically talked about sports, but also remember, in sports, there's winning and there's losing. And we know that there's a lot of emotional things. You'll have parents on the, sidelines yelling, they want you, to win, and you miss and strike out, let's say. They're yelling at you. Remember, we need people there to support those kids. Kids love competition. They always want to win. No matter what you do with them, they always want to win. Mental health. Okay, close the door for me, please. Okay, close the door. My grandson's with me here today. There was no school, can you imagine? Didn't they have Martin Luther King last week? Anyway, dental health. We know that they start losing their baby teeth, and now they're getting all their permanent teeth in. So they should have good dental hygiene. Now, flossing is the best, but children ages 5 to 7 don't have that dexterity to be able to do it. So they're not going to floss at an earlier age, but as they get older, then they should floss, okay? Because they don't brush their teeth, they're going to get dental disease, periodontal disease, they're not going to eat right, nutrition's not going to be good, so all of those things can happen. We know that there's malocclusion and you need braces sometimes. And then dental injuries, on the side of the pool, they come down, they hit their front teeth, and their front tooth pops out. So what would you do if a front tooth popped out? The whole thing, root and all, and there it is. Well, you should take it and put it in cold milk. And take it to a pediatric dentist or a pediatric ER. They can numb the area and put that tooth back in, especially if it's a permanent tooth. You can prevent thousands of dollars of expense by getting that put back in and then having a soft diet after. And the kids actually do really well with it. So dental injuries, make sure if it's a whole tooth out, root and all, put it in the cold milk. Why it works, I'm not sure. I think it's something to do with the calcium in it, and the cool keeps it from, getting infected. I'm not sure, but it works. Sex play, you know, school-age children are very curious, and they really are starting to talk between each other. Maybe they walked in on mommy or daddy. Those things happen all the time. But as they get to middle childhood, there should be some sort of formal sex education. Usually they do it on, when the girls with menstruation, and their body changes. Also, parents should be able to talk to their children about those things going on. Talking about sex, it should be normal. If your son, grandson is always touching their penis, you say, listen, go touch your penis in the other room. I don't need to see that. Don't make it bad. Just say, I don't need to watch you. And then questions. They're going to have questions, especially if mommy gets pregnant. They're like, well, how did that happen? Well, first find out what they know and then answer the questions, because they probably don't know as much as you think they do by the question. So again, keeping that open communication. And there is differences between sex, which is the act of, and sexuality, looking like the female or the male. School nurse, if any of you want to be a school nurse, you have the same schedule as your children. It's a great opportunity. You do all different things. It's all about health appraisals, looking at kids, seeing if there's changes in them, maybe the stress going on at home, educating them. Could be educating them about how to wash their hands, how to cover their mouths, all of these things, coughing. Communicable disease control. How many children I've seen come in and have a bacterial meningitis. We notify the school, and the school nurse sends out a letter. If you're in close contact, you need to go see your doctor to get 1 pill prophylactic antibiotic. And that's what they do. And then they follow up on it. Of course, counseling, some of these kids, ADHD, don't know what to do. You can help them, maybe in the parents, find out what will work. It could be something about, home life. Could be, depression. It could be stress. It could be anything. So school nurses' roles are like really broad. And of course, what do they need for them? Are they having this big sore in their leg, which is maybe impetigo? Well, get them to the doctor and then find out, how they did. So here we go with injury prevention. Well, number one is motor vehicles. I've said that, all ages, whether they're adolescents driving it or hit or, ran over, which of course I've told you I've seen, or it's, the younger kids. Most of the time they're hit or not in the car seat correctly. I had one student send me this great thing about different places where they have for car seats. Could be the fire department, could be public health. There's all different places, and you can even get free car seats if you need to, because this is something that is a necessity today to keep your kids safe. Now, one of the injury things is, remember I've talked about that kid who's, changing emotionally and physically. Remember, a risk factor for injuries is a stressful family environment. If they are, thinking about just what's going on in their house, accidents are going to happen more freely because they're in not the right state of mind. Children should be in the rear vehicle seat until 13 years old. My kids have always, from early, wanted to call shotgun and sit in the front seat with me, right? That's normal for them. But today, they have found through research that it should be 13, and kids should be in booster seats until they're age 8. ATVs, I'm going to tell you a story about when we get to mono about an ATV, but they should not be for children less than 16 years old. It's like this motorcycle with 3 wheels, and they're usually going through fields, and kids fall off and hurt themselves. So it's not recommended for younger children than 16. Children wearing bikes should wear helmets, and then any sports, they should have the proper equipment. And one of the highest injury rates is trampolines. You know, they can fall through the edges, they can fall off of them, they can jump off, break legs, break arms. I've seen all sorts of crazy things with trampolines. I would never let my kids have one. There's one in the kid that's in my neighborhood behind me. It's like I keep waiting for him to scream, you know, that something will happen. And I don't want that because he's the same age as my grandson. So care of the families, you know, families you think, all right, they're school age, they're more independent, you know, it's going to get easier. But some families, sometimes mothers, sometimes fathers, have a really hard time letting the kids do things by themselves, giving them responsibility, but they need to. It helps, again, getting the independence for the time when they move and grow out, go to school, or into their own places. Parents should be there watching, like for instance, going to those sports games, seeing, you know, what's going on with the other children, the other parents, you know, being that unobtrusive, like you're there, but you're quiet and watching it. Because remember, they've gone from family and what the family's all about, and they know that well. Now they've seen all of these different sort of families and cultures, and there's a big, broad world to explore out there. I mentioned briefly with school nurses about ADHD. It's one of those behavioral things that happens. We usually pick it up in school age because these children cannot focus. That's the biggest thing. They cannot focus. They cannot complete a task. They go from one task to the next, to the next, to the next, and they don't finish any of them. And they are distracted very easily. So if you can imagine this child sitting in a classroom with other children, they can't focus, they're going to be disturbing the other children. So if it continues to be a problem, you know, most of these teachers will send them to the school nurse. And the school nurse should sit there and listen to the child and call the parents in. Now, sometimes we tend to think they've done nothing, it's all the parents' fault, this kid is spoiled. That's sometimes the way the mind goes. That's something that we shouldn't do. We need to sit there and listen to what the parents have already done. They could have already put the bedtime earlier. They could have already taken away all privileges and video games and phones and everything. And they're still having trouble. I mean, this is when you sit together. Now you make a plan for that child to help that child not feel so frustrated with this compulsion to move, being distracted, not completing anything. So a child has a knocked out tooth. The parents are reluctant to try to implant the tooth. Where should the tooth be placed for transport to the dentist? Anybody?
In cold milk. Yay.
Absolutely. Good. Yes. All right. Adolescence. You know, I think the adolescence is what I call the roller coaster ride. These are children that go somewhere, they're a kid into an adult, and they're somewhere in between, and they don't know where they are yet. It's characterized rapid physical, cognitive, social, and emotional maturation. We know in that pre-adolescent growth spurt, they grow 25% of their height in 2 years. So they're growing quicker, they're maturing, their voices are dropping, they're becoming men and becoming women. And it is really difficult for these children because of everything they're going through. You know, the primary sex characteristics are what they need to have a baby. Their secondary is all about the hormones, you know, getting menses, the voice changes in boys, the hair growth, breast enlargement, fats, has nothing to do with having babies or reproduction. Now, boys, the first thing that happens is they get a testicular enlargement. It thins, it reddens, and it loosens, and it gets larger. So testicular enlargement for boys. Girls, the first thing that you're going to see is these little breast buds. Now, in girls, the one thing that we need to be careful is, I mean, with boys too, but with girls, we can see something easier. If we're starting to see a girl, they can have irregular menstrual cycles and may not have it every month, maybe one day, maybe half a day, and maybe 3 days. It's completely changed, in some of them. Sometimes they get really tall, maybe they gain weight, and they can be moody. This is all of those hormones that go on. They say when puberty starts, usually menstruation is 2 years later. That's usually what it is. At age 12, boys and girls should have the HPV virus, that 3-dose series of the HPV vaccine, in order to prevent. Now, one of the things that describes puberty in boys and girls is tanners. And if you look at this, 1 is nothing, 5 is they're completely an adult. So if you want to remember these stages, which you need to, you look at them and say, all right, so now we're up to this level. Well, it's probably age, 3. They're getting breast, they're getting more hair, etc. And boys the same way. So their sexual maturation is now, as I said, they're growing, right? So now they're into puberty. They're growing 20 to 25% of their height within like 2 to 3 years. Sometimes you might see, if you have a girl who goes through puberty early, so I said it's probably about 12, they go through at 8 or 10, probably obesity is going to be associated with it. Boys don't get that. Now, there are voice changes in both sexes, but it's more noticeable in the boys. Usually those voice changes in girls are singing. They used to be high alto, now they're alto, right? So the high soprano goes to alto. Now, Erickson talks about identity, sense of identity. Well, what is an identity? Well, an identity is, what do I look like? My appearance, my hair, my eyes, pimples. Am I heavy? Am I skinny? And the identity is all about body image. They are so into their body image. They want to look good. They want to be a part of their group, their peer groups, okay? Many times, if they don't like what they look like, they can get into a severe depression. And we know that adolescents are emotional. They are getting a boyfriend and your best friend steals the boyfriend and now they're upset, or they didn't get that grade on that test that they needed. And now mom's not going to let me go to the movies this weekend, and emotional. It's all emotional. Now, because of this, and because of this depression, because of body image, sometimes you're going to see suicide in an adolescent. So any warning signs that this child could be contemplating suicide, sometimes they talk about it, but many times they don't. But if you see they're not sleeping well, they're irritable, they're either eating too much, eating a little bit, that social withdrawal, like staying on their own by themselves, or even talking about death, take it seriously. They need help now. That child will commit suicide, okay? Because they haven't processed really what that really means. So be careful with these children. So this is the age where they're almost out of the house, right? So they're trying to define their identity. Well, identity, part of it is, who is going to be their friends? Who's going to be their boyfriend, girlfriend? Does a girl like a girl? Does a boy like a boy? Do they like neither? Do they like both? That's part of it. What am I going to be when I grow up? Where am I going to go to school? Am I going to be a nurse? Am I going to be an engineer? All of these things, they are really trying to figure this all out. It's pretty rough. It's a lot of ambivalence that goes on there. But the big thing is the acceptance by peers. And it's also all about, as I said, their body image, and they'll take the part on of whatever peer group they go to. We know that they are protected earlier, a lot more, but now they don't want parents around. They want to make their own rules. So it goes from protection to trying to like each other a little bit. And we know sometimes adolescents don't like their parents. Some of them do, and it's great open communication, but a lot of times there are not. Teenagers want to do what they want to do when they want to do it without having to do anything for those privileges. So there is that struggle between privileges and responsibility. You didn't take out the garbage all week long. You're not getting $20. You're not going to the movies. And of course, you're going to hear him, down the street screaming and yelling at you, right? That's part of teenagers. So major conflicts over independence and control. And that's usually those ages 15 to 17. What could be suggested is that parents sit down with their child and set a compromise. You want to come in at 1 o'clock on the weekends. I'll say 12 o'clock, but you better be in on time, or tomorrow you're not going out. And I want to know where you are. And here's the phone. I call you, you better answer me. Whatever the rules are, and it's difficult, frustrating on both sides. Peers are more important than anybody here, because it gives that belonging and feelings of strength and power. And we know that when they're off with their peers, they're being more independent. They're not dependent upon mom and dad. So they need those peers to be able to function in society. Best friends are usually, again, same sex. And those friendships are usually those people with the same ideas, and it's that same quest for identity together, okay? And they care about each other. It's been said that the way that you treat your best friend as an adolescent is how you are going to treat your partner for life. So if you are respectful and caring about your best friend, you're going to be a respectful, caring partner for the rest of your life. And if not, you're going to have that same attributes. Now, talking to an adolescent, how do you do that? Now, remember, we are adults, and adolescents think we're going to run back to mom and dad and tell them everything that's going on. And they don't want to be open, and they don't want to be honest. So before we even get into that, we need to have that child, that adolescent, open to us. So they come in with earbuds on and they're listening to music. Ask what sort of music they're listening to. Or maybe you notice they've got really cool new style Nike or Adidas sneakers. Say, hey, where did you get those sneakers? I've been looking for them for your son, your grandson, whatever. And then maybe talk about, do you play sports, or are you going to go to school? Where are you going to go to college? Have you decided yet? So now you've opened a rapport. You're talking. And hopefully they'll start talking with you, and they're going to sort of feel that you're not, threatening anymore. Now, when you are talking to them, especially about sexual things, most adolescents don't want to talk with their mom and dad there. Ask the parents to leave the room and have the child open up and tell you what they want to tell you. And let them know that you do not have to tell the parents what they said. The only time you have to tell the parents is if they are going to cause themselves or others harm. So if they're just telling you they're having sex, they've been having sex, this is what they're using for protection or whatever, and that's why they're having all these urinary tract infections, could be, you have some answers that you can maybe help them not get these urinary tract infections, taking a shower right after, or urinating right after sex, or taking a shower, or cleaning, or whatever, you think it could be that could help these children not get those urinary tract infections. Another thing is, as an adolescent, they're starting to learn their identity, and some girls don't dress up like girls. more on the masculine side. And you have boys not dressing on the male side, dressing more on the feminine side. Number one, if you see this, ask the adolescent, what name do you want me to call you? I have a good friend whose daughter wants to be called Ray, not Rachel, because she dresses more like a boy. I have no problem with that. And that shows respect. And actually, that's a way you can open these children up, because now you've respected them. They didn't have to tell you, you asked them. Optimum Health, remember that 3-shot HPV series to prevent the cervical precancers and cancers for girls. Boys get them too, because you can give them to the girls. So they both get them. Their nutrition today, these kids are busy. They grab a bottle of water and a Nutri-Grain bar and they go out the door, and many of them won't spend their lunch money for lunch because they want to spend it on other stuff. So they save it, so they're not eating right. So any adolescent who's having problems due to nutrition, you need to have like a 24-hour diary. What are they eating in a day so that you understand? They could just be eating a big dinner when they get home, or maybe they just eat breakfast before they leave, whatever it is. So nutrition, they don't do what they can, and they're going to have a lot of vitamin deficiencies if they continue that way. As I said, adolescents are going through this huge growth spurt. They should sleep more, but they do not. Why? Because they're out, going to the school games, going to the movies with their friends, visiting friends. They're studying for exams because they want to get their A's. They want to go to their college of choice, so they don't sleep. So, they should have, but they don't have. They should exercise, but they don't have time. And we have to remind them, brush your teeth, at least in the morning and at night would be nice. Many of them don't. Well, many of them do, but many of them don't. I had to fight my son to get in the shower. I remember that. Sexuality, we know TV, it's unbelievable what's shown there, even on normal mainstream TV. So it is said that, children who are able to watch whatever they want on TV probably will engage in sex earlier, because it's there now. It looks like it's normal and it's right. It's okay. They're doing it on TV, so I will. Another thing is, if they're asking you for information, number one, any information you give to an adolescent, make sure it's facts and provide them with written information, okay? If they're asking you about sex, don't give your opinion. This is what you need to know on birth control. Here's some information, and here's other people you can talk to. Yeah, parents, many of them won't go there. Some will, but many won't. School nurses, great place to go. And school nurses should have all that information there. And then Planned Parenthood. Planned Parenthood, they can go and be seen, and they can talk to people and get proper care. Safety promotion, motor vehicle, right? Number one, injury prevention. Now they're getting a little bit, not as careful. They're picking up dad's gun to look at it because they're older now and it goes off and people get hurt. Part of it. Or gangs, some of these adolescents. We know sports injury because kids want to be the best they can. And maybe they forgot to stretch, or maybe they're doing overwork, overuse syndromes. Those things happen, so getting the proper equipment on these children, having them stretch and knowing their limits. So Matt is 14 years old. He's always eating, although his weight is appropriate for his height. What is the best explanation for this? Number 14 is that pre-adolescent growth spurt, isn't it? Is it normal or is it not normal? He's 14. He's gone through this adolescent, pre-adolescent growth spurt. He's gained 20 to 25% of his weight. He needs that much food. And that's why he's not gaining weight, because he's getting taller. It is normal. The answer is A. Any questions? Great group of kids, huh? School age and then adolescent. So I think I've hit on some key things for you. Any questions? All right, who wants to win a Kahoot today? Justin, are you going to win? Raphael, you going to win? Kayla, she's ready. I can see her. Brittany's ready. I see her. All right, let's just get going, because I could call all of you out. I don't want to do that. So week 3, I'm still amazed it's week 3 already. As I said, it goes by so quick, it scares me. Game pin 7842601. All right, let's get going. School-aged and adolescent children. How does the onset of pubertal growth spurt compare in girls and boys? Remember I told you girls of this age think boys are dumb, right? So they're not mentally, puberty, that hormone, they're still little boys. So in girls, it's 2 years before boys, usually 10 for girls and 12 for boys. A multi-select. What activities are appropriate for a 6-year-old child? So organized sports, they're not quite ready for that yet, okay? Organized as a little league, there's a lot of stress and pressure on that. Riding a bike, jumping a rope is great. They don't have the understanding yet to play a card game by themselves. I mean, maybe picking up 2 of the same type of card, but not solitary yet. At what age should a parent expect to have major conflicts over independence and control with their child? No, these are your teenagers right at 15 to 17. They think they're old enough that mom don't tell me what to do. I'm going to do what I want. And they don't want to have any sort of responsibility to get privileges. Sign of the onset of puberty in girls. What do you see first? And that's breast buds, first thing. Excellent. Good job. The onset of puberty in boys is characterized by And this is your testicular enlargement. That's the first thing that you do see. What do you use to determine if a female has reached the age of menarche? How do we know? We know Tanner staging will show you those physical changes which are showing you that they're having puberty and how long it's going to be till they get, their menses or in menarche, okay? So Tanner staging, you will see that a lot. A child goes to the ER with a low fever, pruritic rashes, and open oozing papulas. Nursing care includes. This would be an infection control problem. What do you think this is? Probably chickenpox. Okay, low-grade fevers, chickenpox, and it's going to be these itchy rashes, but these open, oozing, little bumps. And the other thing I would include is at different stages of healing. And many parents bring these children in and don't think that it's chickenpox, because you can still get chickenpox even if you get the vaccine. It can happen. So you need to protect yourself and you need to protect others. You're going to wear that N95 mask, and that negative pressure room means the air from inside the room doesn't go back out and filtrate in the whole hospital because it's airborne. It's all airborne. The source of injury, whether intentional or unintentional in adolescence, is associated with what? And yes, it is motor vehicles. It's high on all of the lists of all safety problems of all age children. If a parent feels uncomfortable talking about sex education, who's a good resource? They can do anything there, but the good resource is the school nurse, Planned Parenthood, or the nurse. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. What is that all about? And we know it's because peer acceptance is extremely important at this age. So again, he might play something else because of his friend. During admission, the father of a 16-year-old says, "We are Buddhist. Culturally competent care includes what?" The thing about, different cultures, number one, if I don't understand, I don't know, I will ask the parent or the 16-year-old, tell me, what do I need to do for you differently? It could mean that a girl wants a female nurse. It could be that, worry about covering, could be food, could be many different things. And if you ask, you will get a lot of praise for that. They'll respect you because you asked. You just don't assume anything. You don't know, you ask. When teaching sex education and contraceptives for adolescents, what should the nurse consider? So what you need to know is that they need education orally, you talk to them, but they need it in written form, okay? That is how you would do sex education for them. And then you make your plan. A multi-select. The management of obesity, adolescent obesity, should include what? So 24-hour diary is good. And some of those good foods you need to put in there, right? Diversional activities are younger kids, okay? Because you sort of forget about their eating and you could feed them. That would be diversion. You know, adolescents don't want nutritious foods. They want some of their foods into their diet, so not nutritious. Infants go through a predictable sequence of growth and development. This is called what? I will always throw some questions in from weeks before. So it's a sequence, so it's sequential trends. Not a trick question, but that's exactly what it is. Which benchmark serves as the ending period for school-aged children? That's the onset of puberty, or all of their permanent teeth are in, okay? So onset of puberty or all of their permanent teeth are in. Which action would improve dental health in the school-age child? So you should encourage them to floss when they are able. Remember, kids younger than 7 do not have the manual dexterity to do that, okay? So the older kids, yes. Maybe the younger kids, the parent needs to help them do it for them. Generally, the earliest age at which puberty begins is what? Ten in girls, 12 in boys. Yes, girls are always before boys. An 8-year-old says that she has cancer because God is punishing her for being bad. Why does she say this? Absolutely common. Remember, they feel that if they're sick, they've done something wrong and they're being punished. Totally common belief. A 6-year-old needs to get a chest x-ray. What explanation is best? So the technician will use a large camera to take a picture to look inside. Remember, 6-year-old, their imaginations, they hear X-ray and they could mean like beams coming out of it and zapping them and hurting them and bzzz. I mean, their minds are crazy at that age. So it's a camera. Everybody knows what a camera is. I'm going to take a picture. How do you get an adolescent to open up about their sexual history? So tell me about your social life. What music are you listening to? So tell me, what do you do for fun? Do you play in the band? Do you know, where are you going to college? All of those things. Other questions, getting them to open up and feel comfortable with you. And they will talk to you. And the one thing I'll warn you, a lot of times they're going to tell you something because they want to shock you. Something like you don't believe that this young 16-year-old has done this whatever sexual act. You're like, okay, don't act shocked because it's happened to me. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? Have the parents leave the room. You know, when they leave the room, they're more apt to talk. I mean, you put me at that age with my parents in the room, especially my mother, there's no way I'd say absolutely anything. So getting them out of the room and letting them know that they're safe, they will open up. Because if they're in a medical, condition, environment, something's wrong and they want to feel better about whatever it is. So they will talk. Just give them that right environment to talk. A multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? So we'll always say abstinence, of course, condoms, absolutely, and then always hand washing. And I hope that they're taking showers more than once a week. They should be taking them daily. All that hormones and all that grease, yeah, they need them at least daily. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? Absolutely, cold milk. Good job. A nurse planning care for a school-age child should know which thought process is seen. School-age children, how do they think? So school-age children have that ability to conserve. Remember the little Debbie cakes that they made sure my children, they had them till the end of the week. They know that. They also know with conservation where, things in different shapes, there's still the same amount of stuff. They know these sort of things. Magical is more of your younger child. That's more your preschool. They're sitting there talking to their friends as they're playing with their toys, et cetera, et cetera. And animism, again, that's younger preschoolers. What stage of Erickson would you use for a school-age child? School-age children. Remember, these are the children who do some things and do it well. Some tasks they do well. It's their industry. So they either good at schoolwork or good at sports or good at music, whatever. They're good at something. Inferiority is what they cannot do well. So, this is one thing I think you can see before the exam next week. Erickson is something that you should look at to know the levels, because you will see those. School-age children's moral development. Who talks about morality and which theorist? That's Kohlberg. So we know that children like to please as school age, right? The right and wrong is more, again, of your preschoolers. They understand they do something right or wrong. Even the toddlers are getting that understanding. But this goes on to conforming to the rules, doing the things right because they want to please. They are pleasers in school age. I'll multi-select. Anorexia nervosa is characterized by So anorexia nervosa is they take nothing in their mouth, only water. They're afraid to gain any amount of weight. They think that they're fat, even though they're skin and bones, and that severe restriction of calories. Vomiting and purging, which means they eat a lot and vomit, is bulimia. It's different. And there are differences between them. So anorexia, nothing in the mouth, getting skinny, and I still think I'm fat, okay? How do you know if you suffer from bulimia? So bulimia is eating, 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 and then vomiting, vomiting. How would you know the difference between a adolescent with anorexia nervosa or bulimia? Well, in bulimia, you're vomiting. When you vomit, there's stomach acid and it rots the teeth. So if they are anorexic appearing, you look at their teeth. If you see rotting of their teeth, that's a bulimic child, if they've been going on for a while, okay? Anorexia nervosa, their teeth are fine. Bulimia, they're not. Adolescents are what? Somewhere between childhood and adulthood, confused, troubled, and frustrated. They are both of those. What is an adolescent's heart rate? We started out with the infants at 140 to 160 at birth as a neonate. And these are 55 to 90. It's a little bit lower than in adults because their bodies work a little bit more efficiently. If you're saying 60 to 120, actually 120 could be dehydrated or with a fever. So, or in pain. So 120 is a little bit too high. 55 to 90 is a good range for adults, for your adolescents. 60 to 100 is adults. When talking with an adolescent regarding personal health concerns, which is most important? What do you need to remember when you're talking with an adolescent? Let them be able to say anything. Let them be open and honest. And again, don't be shocked because they want to shock you. A parent says their infant puts everything in their mouth based on Freud's theory. You would respond, what? Like, why do they put everything in their mouth? They explore the world through their mouths, and we know that having something in their mouth, a finger, a thumb, or a pacifier, that's how they self-soothe themselves. Very good. Multi-select. What could be a sign of potential child abuse? This is one thing in pediatric nursing that you need to always be a lookout for. You may not see real big obvious signs, broken bones or bruising, but something is wrong with that inconsistency between the injuries and what the history is. Also, sometimes those kids just sit there and look down and really don't want to say anything because they don't want to get mommy or daddy in trouble, or their brother, their aunt, their cousin. They don't want nobody to get in trouble. And you'll see those different stories. I've seen 2 cases in my life, and they both were horrible. But in the end, my job was to keep those children safe. And that's what I did. I made sure my job, I kept them safe, and they got away from the people who were abusing them. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are what? Remember, it's firearms, and they're always depressed, right? Body identity, body image. These children are very confused. They're playing with guns, or they're in, gangs. And then, of course, the depression and suicide. Therefore, homicide and suicide. In the school age conflict of industry versus inferiority, what does industry mean? And that's being able to master a task, whether it is good at spelling, good at sports, good at playing an instrument, whatever it is, I do that well. And as nurses taking care of these children, if we're giving them a task to do for whatever reason, make sure that they're able to accomplish it so that they don't feel inferior because the task was above them. They weren't able to finish it. This is the one thing we should keep in mind. Which age group prefers to be with members of their own sex? As in same-sex peers. And that's your 7 to 11-year-olds. Those are your school age children, the later ones that are now starting to get friends. Absolutely. True or false? Home support is invaluable to the adolescent. They need mom and dad and grandma and grandpa. Do they need that? And they do. They absolutely do. Because in the end, something happens, to the adolescent, out there in public. They need somebody to come home to. They need somebody to support them and to be there if they fall. So they do need them there. They don't want mom and dad around, but if something happens, who do they run to? It'll be mom or dad. So home support is invaluable. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? And that's the teeth. Now, if you look at the other things, it looks like hypothyroidism, dry skin, intolerance to cold, constipation. But remember, they have nothing, no nutrients going in there, no nutrition. But remember, bulimia is the teeth. Anorexia nervosa is not the teeth. They're just skinny, very skinny. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with this adolescent? A lot of times these kids are riding and they don't look and they're hit by cars. And I've had more than one airlifted or an ambulance right into the trauma center. And as you know, I was a primary trauma nurse for the ER where I worked. And my job was to sit there at the head of the bed for this child and tell them what was going on, because you're going to have about 16 people running in, all wanting to do something all at the same time. And they are scared. Also, you have parents there that don't want to get in right away after they find out their child is in the emergency room. So give them explanations and let them ask questions. Keep them calm, and these children do better, especially if they're bleeding anywhere. You keep the heart rate down, the blood pressure down, right? It does work. Cooperative play. Kids work together in order to reach a common goal. This is the one where, like checkers, or I'm going to build a fort, and when they're done, they put the flag on top. That is their goal. They did it. Associative play is where they play together. There's no goal. So there's different sort of plays that you need to remember. What does moral development involve? Again, morality. It's Kohlberg, your theorist. So, right and wrong and a consequence for each. Kohlberg, okay? Developmental milestones are important to observe because why? Like, why do we need to know the fine motor skills, the gross motor skills? Why do we need to know these things? As soon as we can pick up on them, we can do early intervention, give them the speech therapy, occupational, physical therapy, whatever they need. And the reason why I love pediatrics is once you institute these early interventions, children catch up really, really quickly. They're very good that way, and they're so resilient. So early intervention when we catch things quick. And most of the time, it's us nurses who say, wait, this kid isn't doing this yet. And I noticed it last time I saw them. And that can help, this child be more than what they are today. They can be the best they can be now. Lymph nodes in children with normal findings are what? They're not sick. What do you see? You shouldn't be able to feel them at all. If they're sick, you'll see lymph nodes. And if you don't see them, that's what you are when you don't feel bad, when you're healthy. Depriving a child of food, clothing, and shelter is called what? So I've actually seen, I remember a news article, there were two young children playing in the front yard and it was 30 degrees outside. And both children, they were ages 5 and 7 or 6 and 8. They didn't have coats on. And the ball went into the middle of the street and the kid was brushed, not hurt bad, but they called the cops. When the cops got there, they arrested the parents for neglect because they needed a coat. That was part of what they needed. So that was the clothing. So these are things about neglect, that children need proper clothing when they're outside. Whether it's cold, put a coat on them. Which of the following immunizations is given in the adolescent stage? And where do we give immunizations on an adolescent? And we give the HPV virus, and we give even IM injections in the deltoid on adolescents, okay? On the younger children, we do the vastus lataris, right? And the upper outer thigh muscle. But as adolescents, in the arm, unless it's a steroid, and you better put it, in the buttocks because it burns and it hurts the deltoid. That I found out the wrong way on me. ADHD most likely involves which of the following? What does that mean? ADHD. It's attention deficit hyperactivity disorder. It's inattention, distraction, impulsivity, hyperactivity. They finish nothing, and they can be that disruption to a classroom. So again, as a nurse, make sure that we call, if we're a school nurse, get that parents in, talk with them, let them tell you what they've done for the child first, and then make a plan for them. I mean, a lot of it has to do with being on a strict routine, same thing every day, and they do a lot better. Sometimes it's diet. A multi-select. An adolescent has brought into the ER with a drug overdose. What is an initial questions to ask? The child came in with a drug overdose. It's in the ER. They're able to talk, obviously. So I want to know what type of drugs, when they did it, but it's really important. Did they take it nasally? Are they doing IV drugs? That makes a difference in the care of these children. Rehab, it's way too early to even ask yet, but those other questions are really important to understand. And last question. Adolescents typically place blank on peer relationships. And it's an absolute, a high value for sure. Good job. Let's see how we did today. Number 3 is DW. Number 2, EH, or E. Number 1 is Della. You led the most of the game. Good job. And Mia and Lisa. Good job, guys. Okay, what we're going to do is our quiz. What I want you to do is go to your modules, open up quiz 2. It should be ready to take. If it's not, you let me know. One of the things I wanted to mention to you all was the discussion questions last week. I want you to make sure you go and look at the comments I wrote there. I've given you something important to talk about, ADPI. What does that mean? And how you're going to start to think this semester. It's a little bit more, not just learning and memorizing information. It's thinking about, the information they gave you and how you're going to intervene and how do you know things work. So I put something there for you. So another thing is citing within your body of your paragraph. As in, if you use the book Perry et al., put it in quotation marks with the date and put it somewhere in the paragraph. That shows me where you got the information from. So if you got an 18, you probably didn't cite within the body of the paragraph, okay? If you don't know how to do that, let me know, I'll help you. Take me a couple minutes on a Zoom call with you, okay? All right, do you all have quiz 2 up? Is it available for you to take? Everybody put your thumb up. Okay, what I want you to do is go ahead and start quiz 2. And then those who need to take quiz 1, go ahead, take quiz 1. When you are done for today. And I thank you very much for being a great class and doing what you needed to do, with last week's information. So thank you. You make my job a lot easier and I appreciate it. I hope to see you at my review this Thursday. I'm going to go on silent. If you need me, come through chat. Thank you. All quizzes are on camera.